Hello and welcome. Today, we're diving into a fascinating, albeit harmless, condition affecting the tongue called geographic tongue. While its name might conjure images of exotic travels, it's actually a common inflammatory condition that changes the appearance of your tongue's surface. We'll explore what causes it, how it affects you, and what you can do about it. Pinpointing the exact cause of geographic tongue remains a mystery. It's believed to be multifactorial, meaning several factors likely contribute. Genetic predisposition appears to play a role, suggesting a family history increases your chances. Certain triggers, such as stress, allergies, hormonal changes, and possibly some foods, are also thought to exacerbate the condition. It's often seen in individuals with psoriasis, further suggesting an immune component. Despite research efforts, no definitive single cause has been identified. The pathophysiology of geographic tongue involves the filiform papillae, the tiny finger-like projections covering the tongue's surface. In affected areas, these papillae are lost, creating smooth, red patches resembling geographical islands or map-like shapes. These lesions are not fixed and tend to migrate over time, changing shape and location on the tongue. This migration is due to periods of inflammation followed by repair and regrowth of the papillae in different areas. The underlying mechanism for this inflammatory process is not fully understood. Geographic tongue is relatively common, affecting an estimated 1 to 3% of the population. It can occur at any age, but it's more frequently observed in children and young adults. Prevalence appears to be slightly higher in females than in males. While it occurs worldwide, precise epidemiological data is limited due to the condition being largely asymptomatic in many individuals, leading to underreporting. The hallmark of geographic tongue is its distinctive appearance. You'll notice smooth red, irregularly shaped patches on your tongue, often surrounded by slightly raised, white or yellowish borders. These patches can vary in size and shape and will change location over time. While often asymptomatic, some individuals may experience increased sensitivity to certain substances like spicy, salty, or acidic foods. Burning sensations or pain are also possible, though less common. The fluctuating nature of the lesions is a key identifying factor. Diagnosis is usually straightforward and primarily based on a clinical examination of the tongue. A dentist or doctor can typically recognize geographic tongue by its characteristic appearance. No specific lab tests are needed in most cases. However, if the diagnosis is uncertain or if other symptoms are present, a biopsy may be performed to rule out other conditions, such as fungal infections, lichen planus, or other inflammatory diseases. While there aren't distinct subtypes of geographic tongue, it can co-occur with another condition called fissured tongue. Fissured tongue is characterized by deep grooves or crevices on the tongue's surface. Some individuals may experience both geographic tongue and fissured tongue simultaneously. The presence of fissured tongue doesn't change the management of geographic tongue, but it's worth noting the frequent co-occurrence. There's no cure for geographic tongue, as it's generally considered a benign condition. Treatment focuses on managing symptoms and minimizing discomfort. Avoidance of triggers like spicy, salty, or acidic foods can help reduce irritation. Over-the-counter pain relievers can be used for mild discomfort. In more severe cases, topical corticosteroids or antihistamine mouth rinses may be prescribed to reduce inflammation and pain. Good oral hygiene is essential to prevent secondary infections. Because the exact cause is unknown, there's no definitive way to prevent geographic tongue. However, maintaining good oral hygiene, managing stress levels, and identifying and avoiding potential food triggers may help minimize flare-ups. Keeping a food diary to track potential irritants can be a helpful strategy. Regular dental checkups are also recommended for monitoring the condition. Geographic tongue typically has a good prognosis. The condition is usually benign and self-limiting, meaning it doesn't lead to serious health problems. Although the lesions can be persistent and may recur over time, they rarely cause significant complications. Recent research has focused on understanding the role of the immune system and genetic factors in geographic tongue. Studies are exploring potential biomarkers for diagnosis and targeted therapies to better manage symptoms, particularly for individuals experiencing significant discomfort.